There are 3 types of Alzheimer's patients. The first is the inflammatory type. Inflammation can be from anything, from a virus or a bacteria, gum disease, to a reaction of your immune system, to a food sensitivity or food allergy, to an inflammatory response to having too much sugar or too much trans fat. But very broadly, the first type is an inflammatory, trigger. Then the second is not having enough of the right type of nutrient or nutritive factor to actually rebuild, in layperson's terms, the way that the brain works. To be more scientific around it, it's to rebuild what's called synapses and brain functionality. But you can think of it as if the brain is being assaulted by something, it needs to rebuild itself. To rebuild itself, it needs the right building blocks, which oftentimes comes from the things we eat, herbs, supplements, etc. If you're not getting enough of that, the brain, even if you take away the thing that's assaulting the brain, it doesn't have enough matter to rebuild itself. So that's a really important second category. The deficiency of being able to rebuild the brain. The third category is toxic exposure. Now, toxic exposure can be, once again, anything from like mycotoxins from mold to heavy metal, lead paint in your house, or mercury filling in your teeth. The third type is a combination of the first two in a way. Responds the least quickly, though they do respond. Types 1 and 2, which are inflammation and lacking the right building blocks, respond faster. A person could be all 3 types. So it's really important in the navigation and the clinical workup of a patient to figure out which type they are and appropriately provide them the right kind of treatment. It's not minimizing this very complex, very problematic condition to a medicine. It is a really holistic, whole person approach.